When we look at perfusion pressure, no matter what patient comes to you, I think it's a value. If they've got a sore on their lower extremity, it's a valuable piece of information. Some of the sores we're going to see are going to be diabetic neuropathic ulcers that could be on the plantar surface of the foot. That having that mean perfusion pressure, you'll know if you can debride that, trim away the callus, and have enough blood flow to heal that wound. If you have somebody that comes in with a venous stasis ulcer, it's important to know what that mean perfusion pressure is. One, what's your chance of healing that venous stasis ulcer? What's the chance of that venous stasis ulcer becoming infected? And then how aggressive can you get on external compression, that being a medicated multi-layer wrap, or that eventually moving towards compression socks? And what prescription compression can you give? Is it a 5 to 10, 10 to 15, 15 to 20, 20 to 30s, or 30 to 40s? Those are all decisions that you have to make. And without something like perfusion pressure, you're making these decisions somewhat in the dark. Where now BlueDop Vascular Expert will give you information that can help you make clinical decisions on the treatment of your patients.